As we have promised, we're going to demonstrate how to do a 5-minute couples massage, because even a man will massage you for 5 minutes. Most of us, we're going to start by starting at the bottom of the spine, and we're going to move in circles. I'm using my hands and moving in circles outward, pushing up and outward. This helps to relax the base of the spine, the sacroiliac joints, and if you feel like there's little knots, which I feel right here, there's a little bit of a knot there. When you find a knot, you want to use circles in both directions, to the right and to the left. And usually, one side will be worse than the other, but the other side needs a little love too, so we're going to do it there too. As you can see, I'm moving circles both directions where the muscle feels knotted. Then we're going to go back to our original method and just using our hands and thumbs, just pushing upward.
On both sides of the spine.
On both sides of the spine. Of course, your patient must let you know if you're ever too rough. You want to do it to patient tolerance. If it hurts to them, they're going to tense up and they're not going to relax. I found a little tight spot right there, so I'm going to do the same thing. Circles in both directions. Clockwise and counterclockwise. That went away quickly.
I'm not ready.
Kelly often complains that he releases too quickly. He doesn't get enough of a rub that way. I found another little knot here. Again, we're going to do circles in both directions. And then no matter what, on both sides, you want to get under the scapulas a little, under those wing bones. And again, I'm pushing headward at this point. I take my thumbs, or if your thumbs are weak, you can take your entire hand like this. And just get in that little crevice behind the inside of the scapula. You can see I'm working my way up. Again here, a lot of times we're going to see a little pressure in that area, especially whatever the dominant hand is. But because Kelly's a regular TrueAlign user, he's really good. But we're going to pretend that there's a knot here. And again, we want to do circles, both directions. Then when we get to the neck area, we want to start by pushing a little bit forward at the base of the neck where the muscles attach. And now we're going to do little circles here. Again, circles both directions. I'm going to work my way down the spine, circles both directions. Then once we've worked our way up this way, now it's time to work from headward. We've worked from down up, now we're going to work from up down. We're going to do very similar, but this time we're going to be pushing downward on the muscles. Want to get again in that little crevice, medial to the scapula. And again, if somebody's tender, let's say this is too much pressure, what you want to use is the heel of your hand then. Spread it out. That's more tolerable. And then I really like this form of traction. All I do is hook the bottoms of the heels of my hands at the sacroiliacs and push headward. And I simply rock my body back and forth. So it's super easy to do. It's really effortless. Then I would just suggest if there's any area of specific complaint, like let's say if they had a sciatic nerve problem and there was more love needed in any area, I would just go back now and take care of that. And another little technique that we can do here is to stretch it apart. Like we take a contact diagonally at the sacroiliac and then at the base of the rib cage area and just pull apart like an X. This way and this way. And sometimes you might even get a little, where like just then, Kelly just popped in, what little bit he was out here, it just went into alignment. That's a good thing. You're adding on to what gravity would do.